Full day, and I hope you have had a good start with your pregnancy, your day today to begin with. There are a few things which I would like to emphasize on is that taking care of your own health is very, very important and it's very, very necessary. But how can we do this? We have to understand that we take care, utmost care of our health by pampering ourselves, following the rules, following the vitamins and medicines which the doctor has given us, and also we need to keep a diary, like a journal kind of a thing, where we are creating memories for our future. Now, this is important for us to understand because pregnancy is a lifetime experience, not only because you're, you want to extend your family or because you are looking forward to grow as a family, but the experiences of each and every new mom is going to be very, very different. So believe me that being a mother is a blissful thing, but there are a few tough times which we follow, and that is why we have to understand that motherhood is something we have to really work on. So now for today, what we are going to have is a few set of questions, which are going to be I am 4 months pregnant, and I have pain in my legs. What can I do for this? Now, I would like to tell that, hey mom, congratulations. This is a very wonderful phase that you are exploring. But since you're in your second trimester, experiencing a leg pain is very, very common. It could be due to weight, or it could be due to hormonal changes, or it could be due to the body changing its shape. Make sure that you have a good, healthy diet and you're taking your calcium supplementations. Along with that, I would also recommend you to check on to your vitamin D3 levels because calcium and vitamin D3 help in strengthening the body. Okay, you can also do some warm compressions with a hot water bag, and that will help you to reduce the leg cramps. Start a little bit of stretching exercises and rest your legs if when they are elevated. So what will happen is that during this course of time it will really help you to understand that these small things which we generally ignore need to be reversed for a better way, right? And it will definitely help you to have a good relief for the pain. I wish you all the best. Now the next question is, कैन वी एप्पल बॉईल करके उसका जूस क्या हम लोग दे सकते हैं? This is for a 7-month-old baby. Now, over here, I would like to interrupt and tell the new mom who is started with complimentary feeding कि आपको कोई भी फ्रूट बॉईल करके देने की ज़रूरत नहीं है क्योंकि उसके जो पौष्टिक पदार्थ रहते हैं वो खराब हो जाते हैं. इसलिए एप्पल बॉईल या स्टीम ना करें, उसको हल्के से ग्रेट करके दे सकते हैं जिसके कारण वो बच्चा जो है आसानी से खा पाएगा. So do not worry about it. Things will be beautifully taken care of. Second, our next question is by the user. My baby girl is 40 days old, but she keeps spitting out milk and while she's sleeping and playing. So I would like to help the mom over here whose baby is just a few weeks old that spitting of milk uh, while sleeping is very common. This is due to रिफ्लक्स मतलब जो अंदर जो दूध जा रहा है वो बाहर आ रहा है because the baby is always in the lying position, so you have to burp the baby and hold the baby upright in this position and always massage in the downward direction. This will be beneficial, and enjoy also ensure that you are doing a good thing by helping her out to feed properly. The next The next question that we have today is, my baby cries a lot nowadays. I am very much frustrated. She makes me feel uncomfortable indoor and outdoor. What do I do? I would like to tell you that mom need not worry. The baby is trying to adjust, is trying to cope with the environment, and we have to help the baby out rather than being frustrated. At this point of time, we do not have any option, but we definitely feel that working towards the betterment of baby's life is something which we can really look forward for. Okay, and this will not only help us to be positive, but it will also help us to guide our own self in a way how do we handle our baby in a much better pattern. My next question by the user is, hi, I would like to know if anyone has ordered any feeding nightie, and how do I order it? Does it have a muslin cloth? And how should we use it? Now, feeding nightie is something which is important. It is it is a fact that you are able to nurse your baby well. Feeding nighties are very comfortable. You should use the ones where cotton cloth is there, and definitely it will be helpful for the mother because she may look for a comfortable clothing which is available at any given point of time. So need not worry about it. This will be all helpful for you. Okay. Next, what I understand is, hello. I would like to know, has anyone given any other baby food for a 8 month old? Well, I would suggest that giving breast milk is something which we all look forward for, and we need to give solids 3 times a day. You can give some vegetables, some fresh fruits, some oats porridges, ragi porridge, suji with milk, dalia kheer, khichdi, suji idli. These are a few things which you can give to the child. This will also help to increase the weight of the child. So definitely we should not be worried, or we should introduce things which the child will be more comfortable in. Okay. Our next question for the day is, my baby hardly sleeps 3 to 4 hours during the day, and same is also at the night. He is 2 months old, and compared to other babies, his nap time is only for 10-15 minutes. Is there any problem? Please suggest me ways on making him sleep longer. Now, this is a very good question because how the baby sleeps is not in your hands, but the baby should be sleeping for a longer period of time because you have to understand that sleep development happens only in sleep. And when we talk about baby development, we are more focusing on the mental and the physical development. So, if the baby is sleeping for a longer time, is sleeping for a shorter time, and getting up quite frequently, keep him in a room where there is no disturbance. The curtain's size is different. The curtain is different. Also, you have to understand that the baby is kept in a secluded environment, and also that there is no other distraction which helps the baby to, there is no other distraction that makes the baby sleep go different. So these are the ways which you can work through it, and definitely you will find success. Our next question for the day, our next question is, what should we eat for a healthy recovery after C-section and for healthy breastfeeding? Now that's a very beautiful question because most of the traditions and most of the customs have different aspects that we need to follow. Secondly, what we are looking forward is that eating healthy is very important because you're not only feeding your child but you're also taking care for yourself. You are requiring nutrients to have your increase your stamina, have your energy levels back. And also, you look forward to have a pleasantry day when you're feeding. Not all days are good, so having good balanced meals, having good amount of water, having good amount of green leafy vegetables, fruits, uh, including a lot of laddus, which is alsi laddu, coconut laddu, til laddu. These are a few things which definitely increase the water intake in the body. So these are supportive systems which are definitely helpful for yourself and for the baby. And you can continue doing this till the time you are comfortable. Once you feel that you have to start losing your pregnancy weight, or you have to get back to your routine or to your normal, you need to start a little bit of exercising. Also ensure that your vitamins and minerals are also taken care of. So relax and things will definitely work beautiful in your way. The next question for the day is that um, hi, my baby is 13 days old. She has breathing problems from morning. She faces difficulty to breathe through the nose. We hear noises when she breathes. Is this normal? Now, to answer this question over here, I would like to say that hey, new mom, she is just a few hours old into this world, and she is looking for something which is very, very different. Definitely, what I would recommend you is that breathing through nose could be a difficult, but it could be a challenge for the child also, because she will be, having some seasonal changes, because of which she might be facing this difficulty. So you can give her a sponge bath, and use warm water bath. Avoid giving putting dark clothes. Okay, you can you can put some ajwain potently on the chest, which is bone, so that her difficulty in breathing is, not there. So all these things definitely help to ensure that the child will be having good comfort, also having good amount of rest. Okay. Then the next question is, hi, my baby stool has mucus. Is there any problem? She is 6 months old. I would say that this is quite normal when teething starts because of extra saliva which goes inside the stomach and keeps the baby's surrounding clean. So definitely this is very, very helpful, and a good question, I would say, which you have brought up. But I would definitely like to tell you that if you keep observing this quite frequently, do not panic at any given point of time. Now, moving to the next question. It's a very nice question. My baby is 1 month old, and my husband shakes the baby with love. Will it affect the baby's brain? Hi, I would just say that, hi mom, I understand your concern. Your baby is just 30 days old, and if the baby is being shaken vigorously by your husband, I would definitely help you out over here. Ask him to stop, because the baby's neck is not yet held properly. There could be some strains, there could be jerks, and it could affect it for a lifelong. So definitely you have to be careful in understanding that you hold your baby, and you take care of yourself and the baby. I think I have answered enough questions for the day. If you have any questions, you can reach out to me on the Baby Chakra app and ask me anything to Dr. Pooja. I am there to answer your queries and to make it interesting for you to understand what are the queries for. Thank you. Have a wonderful week ahead.